Perfect. Welcome, everyone. Sorry about the technical hiccup there. It's been the story of our week with town halls, unfortunately. We did switch to a new enhanced security system here. So thank you for your patience today as we get this underway. I'm Cameron Dale, the director of the league, and thrilled to have such an array of panelists here today to talk about the new reality of stabilization here in the state of Utah and what that means at City Hall. Before we get underway, we will have another panelist who will be joining us later on in the program. That'll be Teresa Foxley from EDC Utah. Teresa and I serve on the critical infrastructure subgroup together within the Economic Response Task Force. And one of the big questions that we've received from league members across the state has been access to sufficient testing, masks, PPE, and other sanitation supplies. And Teresa's been leading the effort to ascertain the need and firm up the supply chain. So when she arrives later, she'll give an update there because that's a critical component for cities being able to move to that stabilization phase, which is now the status quo for the next couple of weeks. Even with all the work of the experts from this panel and the internal groups that the league has put together, I want to point out that there's still plenty of questions and we still don't have all the answers. We've been working with state leaders and other stakeholders, and the governor's Utah Leads Together document is a living document. I had somebody the other day somewhat kiddingly say that interpreting these phase guidelines feels like interpreting the book of Isaiah, but it is a living document. And so as more information comes to us and as you are implementing and have questions and concerns about how to implement the recommendations, please let us know, and I'll talk in more detail later in the program about the chain of command for potential changes. With that being said, John, I'm going to turn the time over to John Park, who is a consultant with the League of Cities and Towns and a retired city manager, and he's put together the all-star panel today. So John, take it away.
Hey, everybody, welcome to Orange Day. This is hopefully once in a lifetime day when we go from red to orange. And so I'd like to welcome you here today. I'm pretty excited about what we have put together today. And we'll do this town hall in two different sections. The first subject we're going to cover is making your workplace safe to work as far as it relates to this horrible virus. And to handle that will be Doug Folsom. He's the loss prevention manager of the Utah Local Government Trust. And for me, just as importantly, he's a Cottonwood Heights resident and former member of our Board of Adjustments when I was at Cottonwood Heights. So welcome here. And then we'll have Rebecca Fromberg. She's a worksite team lead at the State Health Department. And we know how busy they are, and to have her here today, we're pretty excited about. And she's going to talk about, okay, now I have an employee that has COVID-19. What do I do? And we should have Teresa Foxley, she's the president and CEO of EDC Utah. They're having a town hall meeting as we speak, and it should be done in about 15 minutes, and she will join us. EDC Utah is doing some fascinating things in the efforts to ramp up the availability of PPE and other sanitation materials, and all the while they're working to do that, they're finding ways to strengthen Utah's economy. So she'll be here just after 10, and if she doesn't make it by the time that Rebecca gets done, we'll just go on to Katie, and then we'll just bring Teresa in as soon as we can. So with that, Doug Folsom, Loss Prevention Manager of the Utah Local Governments Trust. Go ahead, Doug.
Thanks, John. Let me share my screen here. I've got some slides I want to share with you. And hopefully that's working now. Okay, so as we talk about this, I think it's really important to think about, what does this mean for us, not just today, but moving into the future? As we've had introduced to us these risk phases, these risk phase guidelines, obviously we can anticipate going forward additional changes, lightening of restrictions as time goes on. But in these risk phases, we also see general guidelines, and the general guidelines don't really change as we go throughout this process. And so there's some things that we need to keep in mind as we consider our returning to maybe normal business is normal. And I think kind of the obvious point here is that normal is going to be something totally different once we come out of the other side of this. In fact, when we look at the information that was shared with us, they talk about a new normal, not just getting back to normal, because we're probably never going to go there again. When we are, as you review the Utah Leads Together 2.0 plan, we look at this phased timeline. And right now we're at this transition between the urgent phase and the stabilization phase. And that's moving from that red to orange risk phase that we're talking about there. This could last for quite some time still at this orange level. We could get really lucky, and our efforts to contain this virus, may improve rapidly. And so we don't really know what we're looking at, but just looking at the governor's goals in this timeline, we could be looking at the fall before we're really looking at shifting again into yellow or towards that green, recovery phase. And so there's things that we need to be doing now, and there's things that we need to be planning for as we move forward. I mentioned, and there's a couple of these slides that have just a ton of information on them. I'm not going over these in details, but I will make the slides available to whoever would like to have them. And so you can look at them in a little bit more detail. On the state's coronavirus website, they have a document on there that's the risk phase guideline that has all of this information in there. And I'd encourage you to download that and use that, because there's got a lot of stuff in there that we need to be familiar with. How do we interpret it? Well, okay, that's another question. But one thing I want to make sure that we be careful about in, our process of trying to interpret these things is to not think that as we go from red to orange that, there's a curtain being lifted and all of a sudden we can relax, because what we really need to do is avoid, the possibility of a flare up, of exposure if we let our guard down too much. And again, that point that these general guidelines, especially general guidelines for employers, as we're talking about, our office spaces and our work environments, those don't really change regardless of the phase that we're in. We need to be maintaining these. So again, the risk phase guidelines I talked about, for employers specifically, there's 3 different sections. These are your general guidelines for employers. But they also have guidelines that talk about, cleaning and hygiene, for our employees and for our workspaces. And then on top of that, there's guidelines for monitoring people in our workspace for symptoms and identifying and being able to identify if somebody is sick and being able to isolate them and get them back home rather than potentially spreading, a virus around the work environment. As we look at shifting, from phase to phase, right now, as we go to orange, there are a few little changes. A lot of these are more social or more, impacting of the environment outside of the office. One of the things they say is that our interactions can now go from trying to limit our interactions to those in our household to maybe, now we can, increase our interactions with others who are also observing the social distancing and hygiene guidelines. I suppose maybe we need to have a little interview with people before we interact with them to make sure that they're following guidelines. But in a lot of cases, it might be pretty obvious. Leaving home infrequently. Before we were told that we should, be limiting our travel to essential travel only. Under orange, we're not being told that it's essential only, but we're still being told that we should limit our travel, and leave home infrequently. Those groups that we can gather with, it goes from 10 people to 20 people here, but we still need to be able to maintain social distancing standards and maintain those social distancing guidelines. And so even though we're allowed larger groups now, those groups have to be able to function within, the space. And so it can't just be like a normal meeting cramming 20 people into a small room. We still need to be able to maintain those social distances. Some businesses are going to be able to, open up today. I'm looking forward. My wedding anniversary is next week. I'm hoping to be able to take my wife out to dinner at a restaurant and sit down. And that may be possible with high contact businesses now being able to open up following some strict guidelines and protocols. When we shift to yellow, hopefully before not too long, then extreme precautions become reasonable precautions. Again, this is just like, you're saying, how do we interpret that? What does that mean? And of course, reasonable is a word that, our lawyer friends, those with a legal mind, will talk about what's a reasonable effort. We still need to be conscientious to try to do, what is a reasonable person would expect to do. Schools and businesses will all be able to be open at yellow. These groups can go up to 50, but still maintaining social distancing guidelines. Under yellow, there aren't any restrictions mentioned about, how often you can leave home, nor are there any restrictions mentioned on these high contact businesses either. At yellow, they do specify, though, that this is where an employer can exercise more discretion on remote work. And so where we are asked to work at home if possible, under red and orange, that still stays the same. If we can have people working at home, we should still have them working at home. At yellow, we can exercise a little bit more discretion, but if possible, it's still a good idea, probably, especially under certain circumstances, to continue with remote work even when we get to that yellow phase. When we get to the new normal, we're still told to be responsible and to self-monitor for symptoms, especially after travel. But regardless of the risk phase that we're talking about, we're told to always use extreme caution, especially when dealing with high-risk individuals. And I'll talk about high-risk individuals in the workplace here in just a couple of minutes. This is a great little snapshot of just employer general guidelines. And again, I want to point out, if you read these two boxes for high risk and moderate risk, they are identical, verbatim. They are the exact same guidelines, whether we're red or orange. So for the workplace, there's not a whole lot of change right here in this transition to orange. Again, when we get into yellow, then employers can encourage more flexible working arrangements. Maybe we look at bringing people back to work and rotating shifts and keeping people in groups where they're not interacting, with a lot of different people, and other ways to limit the potential for people to have exposure. As we talk about what does this really mean returning to the office, I know a lot of you have been working from home. A lot of you probably have a lot of your staff working from home or from a remote location right now. Some of you, for necessity's sake, because of business requirements, still have staff working in your office. In fact, I know a lot of the people that we work with, their operations, necessitated everybody still kind of doing business as normal. And so for a lot of you, you may have already implemented a lot of changes in your work environment to try and protect each other. If you haven't, we need to look at that. And for those who have been working remotely and we're going to be returning sometime in the future back to an environment with more people in that office space, we need to think about what do we need to do now to prepare for more people being in our workspaces and to keep them healthy and safe, once they're there. A lot of you've seen these signs going into different businesses. If you're sick, or if you've been sick, or if you've been exposed, don't enter. And that's a good idea to have these signs, ready, have them posted at your entrances. We really don't want to invite people in if they represent a risk for us. Another thing we need to be thinking about right now is, do we need any changes in supplies? And I was glad to hear that Teresa has been doing some work on identifying, supplies and how we can get supplies, because these are some of the things we need to be looking at. Are you going to require your employees to wear face masks when they're back in the office or under certain conditions? Are you going to provide those face masks or require that the employees have them? We need to make sure and identify, how are we going to have the PPE that's necessary? You're probably going to want to make sure you have a supply of gloves for employees under certain circumstances. We may want employees to use those gloves. There's going to be some training that we're going to talk about in just a minute as well. We need to understand how to use the PPE, not just have it, but what is it doing for us, and how does it protect us, and how do we make sure that we use it in a way that it will continue to protect us. Having antibacterial soap, we probably have soap already, but there's nothing more frustrating than going into a bathroom and washing your hands and there's no soap there. It's very important now. It's critical that we have these supplies on hand. and hand sanitizer, sanitizing wipes, as well as cleaners and disinfectants that we need to have. In the past, maybe we just relied on our janitorial service or our maintenance employees to take care of these things for us. But going forward in the future, it's something that I think everybody is going to need to think about more individually as well as an organization. And so the supplies need to be available, and we need to know what we're doing with them, you know, once we have these supplies in place. And I'll touch on that and talk about, you know, what do we need to train our employees on here in just a minute. How about our facilities? Are our facilities ready to have everybody back in there with the same protections, you know, that we need to have for everybody? Signage is something that's going to be kind of important. We may think about if we need to provide additional signage or markings on the floor. You've all been into the grocery stores and seen the signs on the floor, you know, indicating stand here while you're waiting in line to try and maintain those social distancing standards. You know, in the workplace, we may do similar things. There may be a sign or a line on the floor that says, this is as close as you need to get to my desk, you know, and to keep unnecessary exposure by people getting, you know, too close to each other. How about the way the office is laid out? Do we have workstations that could be problematic? I remember years ago at a previous employer, our HR clerk had his desk right next to the door coming into the main office. And everybody that entered the office walked right past the backside of his desk within just a couple of feet of him. And, you know, I got really accustomed to that. If I wanted to talk to the HR clerk, I could just poke my head in the door and he was just right there. We redesigned the office at one point though, and he got a cubicle. And so now there was a barrier around his desk so that when you walked into the office, you had to walk all the way around his cubicle to be able to talk to him. I thought that was kind of inconvenient, but he loved it because it provided him with, you know, some protection and a barrier between him and every single, you know, of the hundreds of people who would walk through that door every day. And so whether we need to like maybe move some workstations away from high traffic areas or whether we need to provide some guards or barriers to help give the people at those workstations a little extra protection are things that we need to be evaluating and looking at our work environment. Our employees, are they positioned in a space that they're able to stay protected in? We may need to look at isolating high-risk employees. And so do we have any employees who are over 65 or who have underlying medical conditions? And how are we going to make sure that they're safe? And so there may need to be some evaluation there about their work areas. Do you have high traffic areas in your building, you know, that it's difficult to maintain a 6-foot distance? Maybe you have hallways, and if you're passing people in the hallway, it may be impossible to be 6 feet apart, or in a stairwell, for example, or in a bathroom. And so those are things that we should also take a look at and see how are we going to handle, you know, traffic in these areas. And also we need to look at a sanitation plan. And it's a really good idea. You can have your professional staff that do your cleaning, do a deep clean on a regular basis, you know, maybe once a week or even more often. But throughout the day, there's also going to be needs for being aware of those high traffic areas, high touch surfaces, and how to address those and keep those, you know, safe and sanitary at the same time. And this is going to require an effort from everybody, probably not just from a limited number of staff there. So restrooms, let's think about this. You know, what is the occupancy, you know, ability of your bathroom? Your bathroom is probably designed to be able to provide, you know, facilities for 4, 6, 8 people at a time. But can we do that while maintaining appropriate social distancing? You know, if you're going to wash your hands at the sink and you've got 3 sinks there, I guarantee you if everybody's at each of those sinks, we're really close to each other. Maybe we need to think about closing off a fixture, close off that middle sink, you know, so that as we're washing our hands, there's a little bit more distance there. Urinals are kind of the same way in the men's rooms. You know, we need to think about that. Do we need to close some fixtures, or what are other ways that we can control, you know, people becoming exposed in these tight spaces? Maybe you do have a bathroom that needs to become a single use bathroom because of its size. Again, we still need to make sure that we have appropriate or sufficient facilities for our employees. Again, that ability to wash your hands, so soap and water, but also paper towels. A lot of people will use hand dryers, and I'd like to point out that hand dryers aren't necessarily the most hygienic thing, because if someone hasn't done a good job of washing their hands, sometimes maybe they just wet their hands and they don't wash them with soap, and then they go put their hands under that hand dryer. What does it do? It blows that water off your hands all over the wall and the floor under the hand dryer. And so studies that have been done actually find a really high concentration of bacteria on the walls and floors around those hand dryers. So I highly encourage using paper towels. And another thing you can do with the paper towel is you can take that paper towel and you can use it to turn on and off the water rather than touching it with your hands. That helps prevent, exposure on the high touch surface, with potential contaminants. And we can also use that paper towel to open the door to let us out. Having no-touch trash cans. If you got trash cans that have the little flappy lids on the top, maybe we want to take those off for now so people can just drop the garbage in and not have to touch an extra surface there to put something in the garbage can. And then have also a garbage can in the restroom next to the door, so that if I'm using my paper towel to open the door and exit, I can then deposit my paper towel there in the trash can. I know a lot of you probably do that already in your facilities, but if you don't, please, I think that's really important to add that extra garbage can in there by the door. You also may look at door openers, hand-free door openers, where you can kind of like, sometimes they'll have a little toe hit hook on the bottom of the door that you can pull the door open with your toe instead of your hands. And so those are all things that we might want to look at. How can we make the restroom, more hygienic, as well as making sure that it's, safe and we're following guidelines, for the occupancy load there. Break rooms are another areas where we have these common surfaces that get touched a lot. And so, what is the occupancy, limit of that break room? And maybe we should reduce the seating available in the break room to seating that allows for maintaining appropriate social distancing. Obviously, we want to be able to wash our hands in the break room. There's a lot of commonly touched surfaces in there. You got the microwave, maybe the coffee pot, the refrigerator, and so when people go in there, maybe the first thing they should do is wash their hands. This may be something we want to train our employees on. So before you go to the microwave or the refrigerator, have the ability to wash your hands first, or have paper towels available to use. And so have that available in your break rooms. Again, the no-touch trash can, have it near the door. And if the door doesn't have to be kept closed on the break room, leave it open. That's one less surface that people have to touch repeatedly, is the door handle, going into the break room. Have sanitizing wipes available in the break room too. If I go in there and eat my lunch, I should grab, some sanitizing wipes and wipe down the area and everything that I touched while I was eating lunch. And then that leaves the space, clean for the next person who's going to come in and sit down at that place and have their lunch. And then we don't have to have, the cleaning staff in there constantly, like we see in some of the stores right now, where they have people hanging out by the touch pads constantly sanitizing them. We probably can take a lot of that responsibility on ourselves in our workspaces to make sure we leave those common areas clean when we leave them. When we're disinfecting surfaces, another thing we're going to want to train employees on is that, the disinfectant will work in a certain way. Different disinfectants are, some of them have to be left on the surface for a period of time. If you're using a sanitizing wipe, don't just wipe down the area and then grab a paper towel and dry it. Because the way the sanitizers work is often it takes so much time of exposure between that sanitizing agent and the bacteria or the virus until it can soften up and congeal and kill that bacteria or that virus. And so if you're using sanitizing wipes, for example, you should leave that space wet. It'll dry in just a few minutes, but as it's doing that, it will continue to make that sanitizing more effective. Again, those common touch surfaces, how do we make sure that those are clean, for the next person coming in who's going to use that drinking fountain or the sink, the refrigerator, and so forth. So as we look at training our employees, bringing them back into a workplace in the new normal, what are some things that we may need to do to keep them safe? So I talked about PPE, the use of gloves and masks. One thing that really kind of gets to me sometimes, I look at people where they put on the gloves right now, And you can tell they kind of feel this, sense of security. It's like, I've got gloves on, I'm protected. Well, guess what? That virus isn't going to get into your body through your skin. It gets in, through, membrane, eyes, nose, mouth. And so you touch your face with that gloved hand that's contaminated, it's not protecting you at all. The great thing about a glove is it's easily removed so that that contamination can come off even when you don't have a hand wash sink available to you. So we have to understand, still training employees, don't touch your face. If you use the gloves, how to remove that glove so that you're not contaminating, uncontaminated parts of your skin while you're removing the glove. And the same thing with masks. You shouldn't touch the outside of the mask. If it's doing its job in catching respiratory droplets and other things, when you touch the outside of your mask, you then come into contact with whatever it's caught. And so we need to be sanitizing our PPE. Your mask needs to be laundered, and you need to go through a process depending on what kind of mask you're using to make sure that it's clean, continually, or as you use it. Again, training employees on hand washing. There's a lot of people that don't wash their hands. There's a lot of people who will get their hands wet but don't use soap. A lot of people will wash their hands with soap, but they only do it for a couple of seconds. We really need to emphasize the importance of proper hand washing, and that's something we maybe need to do some training on. Facility-specific distancing. There may be things in your building that are unique to your building that are going to make our ability to social distance and maintain these high traffic areas appropriately. And so take a look at your building, identify those tight spaces, those high traffic areas. How are we going to deal with that in our facility? Maybe in the hallway. I'm noticing in the grocery store, I don't know why I hadn't noticed this before. I was in the grocery store the other day, and I noticed that they had alternating directions in the aisles. They were one-way aisles. You're not supposed to go two ways. That kind of limits people having to pass each other in the hall. Now, I don't know if you can do a one-way hallway or one-way stairwell in your office, but maybe you can. But maybe if we can't avoid that close contact passing in the halls, maybe when we're moving around the office freely is when we require people to have their mask on. If you're in your space at your desk that's controlled and other people aren't in there, you can take the mask off. But if we're up moving around, maybe we need to require that people have that mask on. It could be another procedure that you think about you may need to implement. And what about visitors that come in or members of the public that come into our office? We need to maybe think about how we limit what spaces they have access to. How do we control not having too many people in the lobby or in the entry office at a time? Maybe we do require people to wait outside, if there's, too many people trying to come in. Maybe we do need to have people who are assigned to come in and make sure they sanitize the front door and the front counter on a regular basis, because, our visitors aren't going to do that. And another thing to really kind of think about, I know a lot of our first responders are doing this, but an end of day decontamination. Before you go home at the end of the day, or when you get home, how do you keep from bringing home everything that you came in contact with during the day? And so you may want to train employees on how to do an end of day decontamination. Take your shoes off before you enter the house. Take any gear off that you're wearing, and put it in a bucket. Go in, wash your hands, change your clothes, take a shower, put on a new change of clothing, go decontaminate your shoes and your other gear in the bucket that you left them in outside, so that you're taking precautions to not bring home with you the stuff that you've come into contact during the day. And again, training employees on how we are going to do a sanitizing routine in our high traffic common areas, and especially bathrooms and break rooms. I think we should probably implement a program where we all pitch in to sanitize the spaces that we use when we use them, so that we keep those common areas safe for everybody. And again, training people how to don and doff your gloves and your mask, and to take care of them and to sanitize them so that they, do the job that they need to do. High-risk individuals. If you have people that are working in your office who are over 65 years of age, or anybody with underlying medical conditions, regardless of their age, which could mean that they've got lung, kidney, liver, heart conditions or disease. It could mean that they have asthma. Severe obesity is identified as an underlying medical condition. Anything else that otherwise, compromises their immune system. It could be that they've been having cancer treatment, a smoker, someone who's had a bone marrow or organ transplant, someone who has poorly controlled AIDS, obviously are going to have compromised immune systems. Or sometimes medications that people are taking, like corticosteroids or other medications that may weaken the immune system. If we identify, people in these categories, we need to make sure to take extra steps to make sure that they're able to maintain their workspaces free of contaminations that may be brought in, and make sure that we're taking steps to make sure that they're otherwise safe in the work environment as well. And that may require I'm sorry, was someone saying something?
No, go ahead. I was just going to try to hurry you along a little bit here, Doug. So
Okay. So, when we're bringing people back to work with our high-risk employees, we want to be really careful not to discriminate, because of age or disability. Those are still protected classes. So if we're saying, I'm going to bring this young person back to work, but not this old person because they're high risk, that could potentially be a problem. We want to make sure that they are still given that same opportunity to come back to work to do their job. It may mean that we, have that high-risk individual still work from a remote location, if it's possible to have them do that. But if not, we need to take a look at how do we keep them safe in the work environment, including washing your hands or using hand sanitizer before you go to talk to them, and providing a space for them that is maybe more uniquely able to isolate with a door or something like that, and try to limit the contact that those people may have with multiple different people, so that lowers their exposure. Finally, you want to think about another thing. If you've got people who are off work or who've been working from home, and we now say, oh, you need to come back and work at the office now. You want to think about, with the FFCRA, they have this benefit available to them to take those 80 hours, at regular pay if they're sick or other COVID-related issue that they're experiencing, or if they have to care for somebody who, is experiencing a COVID-related issue. They could have those 2 weeks off, and there's even extended family leave that could be up to 10 weeks, if someone has to be caring for their children that aren't in school because of COVID or something like that. There's a high chance that when you say, okay, it's time to come back to work in the office, that these people may go, I'm going to take my 10 weeks because I got to take care of my kids. And so there's a good chance that when you require them to come back to work, you may find that you have a lot of people accessing this leave that's available to them. So just kind of a thinking ahead, and being familiar with your employees and their circumstances, to try and help them make that transition is going to be very important. So remember, returning to normal, is going to take some time, and it's going to be a new normal. A lot of the stuff I mentioned today should probably become a part of our routine going forward. We need to be familiar with and stay within, to the best of our ability, these phased guidelines, because they're serving a purpose to keep us and our communities safe. Think now, if you aren't bringing people back into the workplace yet, this is the time to think about what new policies, what new procedures do we need to identify? How are we going to deal with this in our facilities? What are the training that we are going to provide to our employees before they come back to work or when they come back to work? And anticipate those potential problems that still may yet come down the road, depending on how employees respond to these transitions or what happens with the pandemic itself. Things could still go either way, and we need to be flexible to be able to respond in whatever ways necessary.
Okay, Doug,
so
I
I
have
kind of thought,
a couple questions. What about taking temperature when people walk in the office? Is that a good? I don't know how you do that if you have a large office, but is that a good policy?
That's a good policy. There's some tech, that's out there that can help check body temperatures, infrared, technology that can be used for checking body temperatures. But it could be as simple as, having a little ear, thermometer that you have people, check their temperature when they come to work. That is definitely part of the guidelines at red and orange, and even into yellow, is to monitor for symptoms. and to provide especially managers and supervisors with some training on identifying employees that may be symptomatic so that we can remove the exposure from the workplace.
Okay,
So
and lastly,
that is definitely something to look at.
yeah. And lastly, is that wicked far apart sign, is that something that the trust puts out, or do we have to make those on our own? I really like that. So
No, I think you have to live in Boston for that. But
you know, one thing somebody brought up in the questions is, should we have a written policy and make sure every employee has that? I think that's a great idea, and I think maybe that's something that us at the league could maybe come up with some kind of boilerplate on it. Work with the trust.
practice should always be supported by policy.
Yeah. Okay. Hey, thank you so much. And would now like to turn some time over to Rebecca. Rebecca, are you ready?
I'm ready to go. So I'm not going to show any slides, but I really do appreciate all of the slides that Doug showed, because a lot of that information is available on coronavirus.utah.gov, which is really your go-to place as a business to make sure that you're doing the things that you need to do to stay as COVID-free as possible. But I do realize that there's some concerns that come up. For instance, what do I do if I have an employee that tests positive? So one of my functions at the State Health Department right now during this COVID response is I'm in charge of a worksite team that we have at the state level. And I want to emphasize that Utah has a really awesome public health system where we have our Utah Department of Health, and then we also have 13 local health districts, which have their own rules around their jurisdiction, and they follow state guidance, but it is a local control thing. So if your business is in a certain area of the state, it's always good to check in with your local health department and see where you are specifically in relation to these colors of risk that the governor has talked about. So in this orange state, what if you get a call from me or another member of the worksite team, and we say, hey, you have an employee that has tested positive for COVID-19. And I've seen all kinds of reactions from, oh my gosh, I have to shut my doors right now, to what am I going to do? How can I stop this? And I just want to emphasize all these measures that we're taking to prevent the spread of this disease. They are really important measures. But also there's something called having a significant exposure. And a significant exposure means that you've been in close proximity to an infected person for 15 minutes or more. And so just walking by someone in the hall, while that's ideal that we want to maintain that 6-foot distance, that's not necessarily going to expose you to COVID. So as we're following those guidelines, let's also really be aware of how it's transmitted so that we cannot have fear in the workplace too as people return. So when I call a worksite and tell them this information, I point them first and foremost to our coronavirus.utah.gov website and the business section and all of the resources that are available to them, and make sure that they're aware of that proper cleaning and sanitizing. And many businesses, especially now where we're going into this opening phase, are already moving forward with regular cleaners. Those you just may need to implement a little bit more of if you just had someone test positive. But I love the temperature checking and the symptom checking prior to coming into work, but that's not going to fully and completely protect you, because there are asymptomatic people. There are people that do test positive but don't have any symptoms. It takes up to 2 weeks for a person to develop enough virus to show up on the test. And although most people do within 2 to 5 days test positive, there is a possibility that someone could still be transmitting it and test negative. So not to, again, cause fear, but just to be realistic about it. So an infected employee obviously should be sent home on leave immediately. And as a business owner, what I will ask you to do is to get me a list of people and their phone numbers of people who may have had that significant contact, like been around someone, maybe driven in the car with them, maybe been in this less than 6 feet close proximity for 15 or more minutes. And so I'll send you via email a list of resources, and those resources aren't just about COVID. In our public health system, we do many types of things to help businesses. We have a lot of resources around creating policies for healthier employees through maybe healthy eating policies or physical activity, or if you are being compliant with the federal lactation accommodation law, things like that. So I want to make sure that, you know, we don't just focus on COVID, that we realize that a healthy business is so much more than just cleaning and sanitizing all the time, that there's a lot of things that we can do. So we try to establish this great relationship with our businesses. And just to let you know, the business team that we have at the Utah Department of Health only is helping right now with Summit County and Utah County Health Departments. All of the other local health jurisdictions do have their own investigative teams and local health educators that will contact the businesses and do a similar thing. But as far as getting something from the state, that will come to those counties that have asked for assistance. And so we do offer those assistance. After you have sent me a list of people who need to be contacted, we have contact tracing that occurs. And I'm sure you have all heard about this on the governor's press updates, but contact tracing just means that we have a team of trained individuals that will call the person and ask about what has happened over the last week prior to them being in contact, or anything that they've done at work or in their personal life that may have put others at risk. And we just try to let them know about self-quarantine and monitoring symptoms. And there are people that do work for essential businesses and that still need to go to work, even if they may have been exposed to COVID. And so we just need to, as employers, be willing to do that monitoring at work, again, the temperature checks, the symptoms. And those employees should be in PPE, full PPE, to protect themselves and others as well while they're determining whether or not they have COVID. There is a lot of testing available. All of the testing sites are available on that website. We have specific spots throughout the state. There's lots and lots of resources. As businesses, you should not require a negative test before an employee can come back to work, and there's two reasons for that. One is that it may give you a false sense of security because, again, if they're in that early stage where they're not showing symptoms, then they may actually have it. So we just need to follow those self-quarantining guidelines, and that 2-week is a really important guideline to make sure that we don't cause anyone to be infected during that time. That's really all I wanted to share today, but I'll be available for questions specifically when we get to that point.
Great, Rebecca, thank you. Thank you, Rebecca. I had a question come in that I didn't know the answer to, and I've never heard it asked before, and I don't know if you're the expert on that, but if I microwave my mask, does it disinfect it?
I have heard that, and that's not recommended as a disinfection practice. You can just really do, cool. There's lots of different ways. CDC actually has a great Q&A. You might be causing fires depending on what you do and how long you microwave it, but yeah, there's lots of other ways to do that.
Hey, thank you so much, and thank you, Rebecca. We're honored to have you.
You're very welcome.
And so now we are, as I introduced earlier, we have Teresa Foxley, the president and CEO of EDC Utah, with us. And Teresa, I'm sure you're on there. Would you kind of speak up and just go ahead? Great. Good to see you.
Good to see you too,
fine.
and thank you so much for the invite. I had the chance to scroll through the participants, and it's great to be amongst so many friends this morning, and also enjoyed being able to hear from Rebecca and Scott a little bit earlier on the risk presentation. So thanks for letting me peek in on that. And as you're hearing about this, you're probably wondering now, gosh, there's a lot of PPE needs that I have to bring our team back safely. And so how am I going to get it? What is it? Where do I find it? And we had some of the same questions at EDC Utah. So we decided to take a sort of top-down and a bottom-up approach to figuring out what the state's PPE needs might be. Last week, we sent around a survey to critical infrastructure, general business, and to cities and counties. So I know, thank you, Cam, you sent it out. We got a number of great responses from the cities. So thank you to those of you who were able to fill it out. But we had 250 responses, and only about 43% of those who filled out and completed the survey had confidence in their existing vendors and supply chains to be able to get the PPE that they needed. We did see that there was a correlation between the size of the industry and their confidence level in being able to get the PPE. And that makes a little bit of sense, right? Because some of these bigger businesses know that they have bulk buying power, or they have already been in the PPE game, and so they have established supply chains. But it's some of these smaller businesses and organizations that are, one, they're trying to understand what the new regulations are. Two, in many instances, they've been hit hard economically through this health crisis, and that's because they've had to close down their business or restrict the way that they operate, and so they have cash flow issues, and they're concerned about that as well. So we were happy to sort of start this process through the survey work that we've done, but we also wanted to do a more top-down approach, and that was through building a model. And we, it's a pretty sophisticated model. We are reverse engineering it. At EDC Utah, we talk about R&D, and sometimes that's rip off and deploy. But we found a really good model from the state of Washington, which was sort of the early epicenter of this, as you all know. But some researchers affiliated with the Gates Foundation and the University of Washington put together a very comprehensive, super sophisticated model that helps us, again, get a better sense for if you were to outfit every single healthcare provider, every single employee, every single person in your state, what would those needs look like and what would the cost be? So we're doing this top-down, bottom-up approach. And what we're finding is that we need to prioritize 3 items based on the results of the survey work and based on what we're seeing. And that's cloth masks, so reusable masks. It's hand sanitizer, which thankfully there appears to be a pretty decent supply of that building here. And then it's surface disinfectant. Those seem to be the 3 things that people are really interested in figuring out where they can buy it, how much they need, trying to do their own modeling within their own organizations about, okay, how many do I allocate 3 wipes per employee per day, and what does that look like, plus an extra one for high-touch surfaces. So everybody's out there doing this math right now. We don't want people to hoard, obviously, but we do want them to get what they need. And so we worked with the Governor's Office of Economic Development to add a PPE section to the coronavirus.utah.gov business website. On this website, you will find a list of vetted PPE vendors. We seeded this with the PPE vendors that we used for the medical supply working group, which our team was involved in, that was underneath Unified Command. There's an intake form there for prospective vendors of sanitizer, disinfectant, cloth masks, etc. And then we are vetting those as they come in. So if a vendor says, yeah, I've got a bunch of cleaning supply, we'll give them a call to vet through how much and where they got it and what the specs are, and then we'll put them up on the website. We also, and this is really cool from an economic development standpoint, we have a little check mark for made in Utah versus not made in Utah. So if you have a preference to buy in Utah and an ability to do so, obviously we encourage you to do that. We know we're going to need to go from outside our borders, but we love to support these local vendors to try and keep some of this new spend circulating in the economy. We do think that there might be some appetite from the state to help some businesses, again, those that have been significantly impacted by this, by procuring PPE. on their behalf, and then either reselling it to them or giving it to them to help them restart their business. The details of that are still very much coming together. And then we're also very much in the early stages, though, of coming up with some other potential solutions, which may go to those 57% of folks that were confident in their supply chain to say, hey, if you're really confident in it, could you place an order of X% higher than you would have for your own employees and do this in public-private partnership to then get some of that, again, buying power and establish supply chain back into the state. So that is what we're working on right now. Again, this is very much an interim update as we continue to build this machine as it's going, but hopefully that PPE section on the coronavirus.utah.gov website is a benefit to you as you are getting more and more employees back to City Hall and in the other critical functions that you all perform on behalf of our community. So that's it from me, unless there are any questions. Thanks, Cam.
Oh, Teresa, thank you so much. Hey, you mentioned a couple of websites during your presentation. Would you just kind of go over those slowly again? So.
Yes, of course. So we're trying to aggregate everything at the coronavirus.utah.gov website. And there is a /business page that has a ton of information for businesses, from everything from the Utah Leads plan to what the sector specific guidance is now that we're moving into the orange phase, and hopefully can move into additional phases soon. But that coronavirus.utah.gov, and you know what, I'll put it in the chat feature there so that you can find it. So let me pop this into the chat feature. Is this only going to panelists or does this go to everybody?
I think it goes, I don't know.
You know what, maybe I'll put it in the, I'll do it to the panelists, and then if it doesn't go to everybody, you guys will let me know. But there's the coronavirus.utah.gov, and then let me pop in the other one, which is the list of vetted vendors. And it's
oh yeah, that was the one, the list of vetted vendors. That was one we wanted to look at.
Okay, I'll pop that in right now. So that is in there.
Oh, perfect. Okay.
There it is. Yeah.
And we will, just so everyone knows, this presentation as well as the slides that were shown by Doug will be available on our website after we're done. And so if you want to review this, we've got it all. So Teresa, thank you for your time. I know how busy you are. You're going crazy. And this is your second town hall meeting today. And it's a Friday and it's only 10:30. So thank you for your time. We so
Thank
appreciate
you guys. The cities are awesome. I really appreciate the chance to be here. Hope everybody has a wonderful weekend.
Okay. Thank you.
Thanks.
Thank you so much.
Thanks, Teresa. See ya.
And now, Katie's from our staff. Katie does a great job with our staff on a lot of what we're doing, and she's been working on celebrations, large and small, and all things that we have that's going on in the state dealing with large gatherings. And so, Katie's just going to take a few minutes and tell us where we are as a league, and take it away, Katie.
Hi, everyone. As John said, I'll just give a quick update on the event side of things. So last week, the league created an internal work group to focus on community events, those being parades, fairs, carnivals, park events, etc. There have been a lot of creative ideas going around when it comes to holding events in our communities, and it's been really great hearing all of these ideas. The work group is currently putting together best practices for community events, and we are holding a follow-up call for next Wednesday to discuss these best practices, which I will then be sharing with the Live Events Recovery Committee that the league is a part of. The Live Events Committee was also created last week and is working on guidelines to get live events up and running. Live events meaning everything from rodeos, conferences, carnivals, weddings, the list goes on. I've been sharing the concerns and ideas from our cities and towns with the committee chairs, and at the moment they're looking into smaller upcoming events that can occur while following the guidelines in the yellow or low risk phase, and they continue to make recommendations on the current guidelines. And the committee has also created subcommittees to better discuss the guidelines and recommendations for specific event types. The league is also involved in the subcommittee. I understand that summer is coming up pretty quickly, and I will work to keep people updated with information as it pertains to community events. But that's kind of the most up-to-date information that I have for you all right now. Yeah, that's it.
Okay, thank you, Katie. You know, I know that all of our cities are wondering about their summer festivals, their summer celebrations, and Katie will have, I think, more for you in a couple weeks, hopefully, about where we're going. So you still have to be patient. I know you want to make a decision and decide where to go. You still have to be patient, and so we'll know what that looks for. Cameron, there's a few things that I would like to cover with Cameron. Part of it is how this all, going orange, green, red, yellow, wherever we're going, is all works, and how you get changes, and some of the information that we're going through. So Cameron, just take a few minutes if you would. Before Cameron starts, can I just add that those of you that are on a short timeline, we'll probably run a little past 11 o'clock. And if we do that and you don't have time to go, I just want to again remind you that this entire presentation will be on our website, and you can circle back and catch that later. So thank you, Cameron.
Perfect. Thanks, John. And sorry again that we started late, but we will run long because we want to make sure to give the panelists sufficient time to give their updates. What Katie just explained is very important for people to know about the live events. When we're currently in orange, you're still at that higher level of stabilization. When we move to yellow, that opens the door for additional live events. And what Katie is working on with stakeholders around the state and with city and town experts is what should those guidelines be in yellow for live events, so that you understand what you need to do if you decide to go forward with live events this summer. We are currently on Utah Leads Together 4.0. So we've talked about 2.0 extensively. What the governor ultimately adopted was 4.0 as part of his order yesterday. That will be in effect for a couple of weeks, and then he'll be reevaluating it by the day based on the health data. So it's possible that we could be at yellow statewide in a couple of weeks. It's possible we'll still be in orange. It's possible we could go back up to red. But what we've been doing internally has been to say, okay, what are the guidelines now for orange statewide? How do we implement those? What are some of the best practices? You're about to hear from panelists on those fronts. And then if there are changes that need to be made, either local changes for your local needs or changes to those larger guidelines, what's the process for sharing that information? And discussing that with both state leaders and leaders at the local health departments, there are really two paths here that I want to point out. Path number one is if you're looking for essentially a local variance. You may have a hot spot and you feel like you need to do restrictions above and beyond orange, or you may feel like the health data in your area require local variance that would go down to yellow. You need to make that type of request for a local variance to your local health department, who then in turn will go to the state level and consult with the governor through the state health department. The other path is if, as we're implementing these guidelines, we recognize that there may be some changes that are necessary to 4.0, and that would be in the future phase guidelines of 5.0. The commission is reevaluating the guidelines a couple of times a week in their meetings, and staff is reviewing this every day, every hour of every day. So what we're doing at the league, in conjunction with the local health departments and the counties, is that we get your input about 4.0 and potential modifications for 5.0, is we are aggregating those and making requests to the commission. So that's what Katie will be doing on live events, and that's what we've been doing around the recreation services, which will be the focus of the rest of the panel. So I just wanted to give people an idea of that process, so you knew if, as you're implementing these best practices, if you wanted to pursue potential changes, those are the two paths. The panelists that you're about to hear from will be talking about 4.0, and then also talking about the potential best practices and recommendations that could turn into 5.0. And we're grateful for all the work they've been doing behind the scenes, and looking forward to hearing what they have to say to help you navigate the orange phase. So John, I'll give it back to you to bring the rest of the panelists. And again, we will plan to go we'll go past 11 o'clock and and hopefully people can stick with us. Thanks.
You know, it was funny. Last night, Cameron and I was on the telephone with a bunch of local healthcare officials, and we went through what Cameron just explained, and at the end of it all, I got back and says, Cameron, you have to cover that tomorrow. I did not understand any of it because it goes every which way, and it's just we're learning by doing in this whole process, and that process that he just pointed out probably spells that out as well as anything. So the rest of this is going. We've had a great group together that is putting some best practices around what we call quality of life issues, and they take care of recreation centers and organize youth and adult team sports, swimming pools, and parks and playgrounds. And so we're going to go in that order with Bryn Bybee, the Assistant City Manager in Orem, Mark Christensen, the City Manager in Saratoga Springs, followed by my City Administrator here in Pleasant Grove, Scott Darrington, and then Nancy Day. She's the West Valley Parks and Rec Director. So we'll just go right now to Bryn Bybee. Bryn?
Yeah, thanks, John. I'm going to go ahead and share my screen here. And yes. So as we go through here, you'll notice that this is a Word document, and I believe the plan is to share this document as a Word document or in an editable format, because even since the last iteration or the last version of this plan here, this phase-in plan that we have put together, I think we've had in Orem a couple of updates just even since yesterday. As I go through here, I'm going to focus in on those things that are in the orange phase, but we have gone through and made attempts to show how we might continue to open up more and more aspects of our fitness centers and pools and parks into the yellow phase. We kind of acknowledge here that we're getting a lot of information from a lot of different sources, and a lot of this in its current version was based off of the governor's latest version of his plan. But we acknowledge that we continue in conversations with our local health department, and that we continue to communicate with them so that we can make sure that we're interpreting and applying the different aspects of the plan appropriately. You know, one, just to kind of, I guess, emphasize the point that this is continually changing. You know, we had originally identified different facilities and different parks that we thought we'd be able to open up, but even, again, talked about an update even since yesterday. We've since decided to keep our futsal courts closed, understanding that would be more of a team sport and contact nature sport. So as much as I love soccer, we have actually moved that into our yellow phase. So I hope that as this gets shared, that other cities and organizations will be sure to just take it, I guess, a little bit as just a basis to start with your particular application of these different points. We kind of make an acknowledgement right at the get-go that we know that there's that new 20 people limit in groups. And part of our effort to try and meter the access into our fitness center is, at least to begin with, we're only going to open up to current pass holders. And that's because we have their contact information, and we can then roll out a by appointment or sign up basis with them. And so, at least for now, so that we can, again, meter or control the amount of people that are in our fitness center at any given time through a sign-up program, we're just going to limit it to current pass holders and not kind of our daily pass type patrons. We acknowledge early on that all of our fitness centers are different, and even within our own fitness center, we're currently actually in a temporary location as our rec center is being rebuilt. And so different spaces have different sizes. And so we're going to go by this one person per 120 square feet standard. And so we've gone around and double checked the square footage sizes of each of our different areas within our rec center to make sure that we know what kind of the occupancy limit is going to be of each area. We're going to do our best with either blocking or moving our equipment in order to try and keep a 10-foot distance. Realize that's a little bit more than the 6 feet apart kind of social distancing requirement, but we're going to try and understand if there's going to be some in and out of people. We're being a little extra cautious in that regard, and we're going to either, like I said, either tape off every couple of pieces of equipment and or move it around so that we can ensure that people are staying separated.
Hey, Bryn, some people are kind of having a difficult time hearing you, so can you move closer to the mic or speak up or whatever? Thanks.
Okay, I will yell.
Good.
As part of, I guess, kind of an expectation of kind of self-responsibility, we'll provide, to the extent that we can, disinfectant wipes and hand sanitizer for staff and patrons to be able to disinfect equipment and areas as they use it. We also plan during this orange period to disinfect and have cleaners come in every hour. And then we'll be posting extra signage to let people know what that cleaning schedule is so that they can stay up to date on that. Our employees will be going through symptom checking and I think we've kind of covered the expectations that we will have of our employees. To the extent that we can, we're going to encourage our patrons to abide by the same type of social distancing guidelines and encourage them to wear appropriate face coverings as well. And then, we recognize that those patrons, if they choose to not comply, that we'll have a customer service opportunity with them, and we'll have to ask them to leave if they are unwilling to abide by those. I think, like many are already planning and trying to do, we plan to install cough screens at our front desk and post signage and tape the floors so that we're keeping potential areas where lines can accrue. We're keeping people apart and keeping ourselves safe. With our classes, basically, there's certain rooms, certain classes that we know and acknowledge that we're not going to be able to do, but we do have kind of a bigger 2,900 square foot kind of gym area, and we think that we can provide some classes in there and make sure that we limit the class size and keep people apart, including the employees that will be providing the classes. So basically, we're kind of trying to approach this with, I guess, a scalpel as opposed to a sledgehammer approach. Again, it'll be based off of the size of the class. We are planning to open our cardio and weight room. Mentioned that we will be limiting and moving around equipment. Another thing that we have that I'm not sure that everyone will have with their weight room is the ability to open up some doors to make it, I guess, a little bit more of like an outdoor type feel. And get some more kind of airflow and breathability in there. Let's see here. We divided up throughout this document different spaces and know that we're going to need to have extra cleaning in our restrooms. One area that we know we're not going to open is our locker room and change rooms. So we're going to extra communicate with our patrons that they come ready to work out and that they're they would go home in order to change afterwards as well. And then at this time, we're not planning to open up our child care. In terms of basketball, racquetball, other group sports, again, because the way we're interpreting the governor's plan, because those are more contact in nature, we're not planning to allow those to open at this time. We're trying to keep open the potential exception that if they're a small group and they're from the same household, we may allow that. I think that kind of pretty much covers the I guess dry side of fitness centers specifically. Well, I guess other than with tracks, we're going to try and limit the amount that people can be in a specific lane at a time and space them out. And then in our lounge areas, we're either going to take out sitting areas or at least decrease the amount of opportunity there is for patrons to sit. Basically understanding that we want them kind of in and out of the use of the facility. So with that summary on the fitness center use specifically, I guess I'll turn the time over to Fu, John.
Yeah, thank you. Thank you so much. Yeah, I think in 4.0, they took out the requirement for the 120 square feet, but you know, I still think that's a problem that you may or may not think, depending on the layout of your rec center, that is a good number. So look at that. And again, all of these, before you're open, it's a good idea to talk to your local health officials, as Brent mentioned, that's what they've been checking on. It was interesting as we went through this because a part of this group was actually headed by Sean Guzman, St. George City attorney. And a lot of these recreation center are just going to be requirements are just going to be recreation center centric. People have old ones, people have new ones, that people have different layouts, and so it's a really hard call. But anyway, those are some guidelines that'll be available to you after the thing to look at. And thanks, Brent. Thanks for your time. Now, my city administrator, Scott Darrington. Scott.
Hello. Good to see everybody virtually, I guess. It's interesting as we've been studying the swim pool issue the last 2 weeks. There were certain things that we would really wanted the state to address, and that was what it boiled down to was under the old orange rules before 4.0, we were allowed to have half capacity for our pools, which in Pleasant Grove, in our outdoor pool, is 350 people in our pool. And that blows away the idea of having 20 people or less as a gathering. And then the idea of social distancing people in a pool when it's mostly kids logistically was just didn't seem feasible. So we pushed the state, I think, to give us some more direct guidelines. And then yesterday we received those guidelines. And so we'll talk about those first. And you guys probably have already seen this, but just so you can review it, we can kind of talk through this a little bit. But under the orange phase, so we'll talk about this and then we'll come back to a couple other things. But under the orange phase, right now, if you're going to have a pool open, you can do lap swimming, one swimmer per lane, nobody congregating on pool decks. You can also have a swim team as long as they can maintain a social distancing in regards to being in the pool, and then also on the pool deck as far as that's concerned. So if you're looking, according to these new guidelines, if you're looking to open a pool under orange, these are going to be the limiting factors. So really there's not a whole lot you can do. I think for a lot of our pools, the free play is really the big ticket item. If you go to the yellow, which is these guidelines over here, and there's probably going to need to be some massaging of these before we actually get to yellow. It is saying that pools can open at a capacity that allows 6 foot of social distancing to be maintained at all times. So the way I interpret that is you kind of measure out your pool in maybe 6 foot squares, and how many ever squares you have, that's what your capacity will be allowed. It does say underneath that the social distancing is to be maintained on the pool deck and in pools. That's a pipe dream in my mind, but that's probably going to come down to just how willing we are to enforce those rules when we get there. Lap swimming can continue as normal. For instance, some people might have 2 or 3 people in a given lane when they're doing their lap swimming. And then the swim team and swim lessons would be allowed under the yellow standard as long as their social distancing is maintained. And then they're asking us to put up signs everywhere asking people that when they're in the pool to maintain the 6-foot distance. So as we looked through this, as we've been working with some aquatics people, the URPA has been involved. The URPA has some of their own guidelines on this as well, which I think our standards are pretty close in regards to what URPA has put together and what we've put together. So I'll just go over briefly some of the things that I think, did that come up?
Yeah, it's good.
Okay, the swimming pool recommendations and thoughts. So top priority is just the health of the individuals that are there and the health of the employees. Social distancing, we've already discussed. That's in the 4.0. The protocols in the pool areas, essentially under orange, nobody's allowed on the deck. If you go to yellow, people are allowed on the deck. You just need to maintain social distancing. If you have an indoor pool, that's probably a little bit more of a challenge. We have an outdoor pool with plenty of room that we could spread people out. But that's something that everybody will need to consider. And then employee safety is really an issue, particularly for lifeguards. They might have to go hands-on, whether it's a rescue, whether it's a CPR, or maybe even mouth-to-mouth in certain situations. So if you're in looking at opening your pool, you just need to make sure that your lifeguards have the proper PPE. There are certain things that they have. They have some mouth shields and things like that in order to kind of limit whatever they can do on some of that skin-to-skin contact. We didn't really delve into what happens if an employee has to go hands-on, and then do they need to get tested and things like that. I think there's probably certain things as a city you're going to want to look at as far as your risk management on that. When it comes to locker rooms, showers, and restroom facilities, the recommendation is to have your locker rooms shut down and your showers. The restroom facilities would need to stay open for those that need to use those. The idea is that people, in essence, they're going to come. We would prefer having people shower before it gets in the pool. There's a health issue there, and I'm not sure what the easy answers are. In Pleasant Grove, we do have a shower right on the outside of our pool that people could use, as opposed to being in a locker room. We would prefer that people change before they come to the pool, and then in essence they're going to need a towel. They might be a little wet as they go home, but the idea is that we would have the locker rooms not available as far as that's concerned. And then cleaning will be important, just the high touch areas. Some places talked about, hey, we're going to allow the swimming to go on for an hour and a half. We're going to get everybody out of the pool. We're going to do a quick clean on certain surfaces and then let everybody back in. A lot of pools do that anyway, just for safety precaution. But then trying to keep people social distance out of the pool, that presents its own challenges. We've talked about swim lessons and swim team use. And then we just had some thoughts. Is opening a pool right now a good idea? And this was more when the orange phase was saying that you could have a 50% capacity. So our recommendation was pretty much what the state went with, which is under orange. It's probably not a good idea to have at least open swim. And then we talked about the benefit to the community. These are large morale boosters for our community, for the pools to be open. So if we can get them open, let's get them open, but we just have to figure out the safest way to do it. There are financial considerations. Our swim pool, we already subsidize out of the general fund. If we're operating at a capacity less than 100%, then it will probably just continue to be more of a of additional cost to us because we have a lot of fixed costs when it comes to having a pool open. And then our final thoughts were there's not really a one size fits all. So we do get guidance and direction from the state. But I think each municipality or community that has a pool is going to have to make some of their own decisions. I think sometimes we get a little frustrated that there's not some more specific things from the state. But in some ways, I think the state is allowing us to make some of our own decisions as far as what we feel we need to do. So that's it on what we've contemplated on swim pools.
All right, thank you, Scott. I went out of order a little bit, so took Scott by surprise and left Mark hanging. So Mark Christensen, let's talk about sports, team sports.
You bet. So I want to kind of emphasize the importance of perhaps the comedy of this all is that these are guidelines as opposed to laws. And so I think that there is a little bit of humor in the fact that we don't have hard deadlines. Are you seeing my share screen?
We can.
The phased guidelines?
Yep.
Okay, so for us, 4.0 changed things a little bit. We did our work late last week over the weekend and the first of the week. And so the 4.0 changed some of the things dealing with outdoor recreation. Page 5 of the phased guidelines really kind of hits it for us, which basically says, do not engage in close contact or team sports. And so we were looking at kind of the range of sports and the range of things that we offer as a philosophical discussion, if you would, as to what could we do to make these things safe and what could we do to make various types of sports doable at the various phases. And so we'll share this. So let's not spend too much time because we are going a little bit long, but there's two important things. What's the risk level that we're currently at? And then we felt as a group that the mass gathering restrictions was really one of the larger defining factors as to whether you could successfully pull off a sports program. And unfortunately, we think that most of these programs either come in at about a yellow or potentially at the green phase, just based on the mass gathering restrictions. It also created a lot of questions for us as a group that we've sent back to CAM and we're hopefully going to get some answers on from the state. Because, for example, do we consider a baseball field or a diamond, is that our mass gathering restriction, or is it the park? And the irony of it all is the hypocrisy of how we can fit hundreds of people into a Walmart, yet we're limited on a per square foot basis in recreation centers and all these other conversations that we're having. So again, we felt like there was these two key things. We felt like, some of these sports you potentially could do. We've come through and we've tried to identify things that you could do that would potentially limit the risk that's there. Again, I'm not going to go through these in detail, but for example, baseball, if you were to run a successful baseball or softball program, you're probably going to have to consider that you're going to have to sanitize your equipment. Using a Clorox wipe on a bat is probably pretty easy, but what do you do with helmets? What do you do with a recreation program like ours that gives a half a dozen helmets to each team, but are you sanitizing those helmets in between each use? It becomes a very difficult challenge. And so what we've done is we've tried to identify the various sports and come up with some things that you should consider. Again, if this is a guideline, each of the communities are going to have to try and figure out how do you mitigate physical contact, how do you deal with spacing issues. We felt like fan spacing was probably the biggest challenge. Those that were in our group that are recreation managers, they felt like if you could remove parents from all recreation, youth activities, youth recreation, it would actually probably be the ideal rec programming scenario. But we know that parents are going to want to watch their kids and they're going to want to have people there in the stands. We felt like if you were doing volleyball, perhaps some outdoor volleyball, you may be able to do that opening your volleyball pits or something like that in Orange. The problem is, as we saw in some of the media that hit, I think over in Orem, is depending on how many people start to congregate. So again, that triggers that mass gathering restrictions. Some of the things that we put in here may give you some ideas on whether you could open up, say, your pickleball courts or tennis ball courts. We felt like those may be appropriate in the orange category. Again, depending on if you limited it to family use or something like that. I think Bren mentioned that. So, but again, most sports, we felt like really you're not going to be able to offer most of them until the green. Now, this was based on the 2.0. Under the 4.0, we feel like we're probably going to be able to be a little bit more permissive in allowing some of these sports to begin playing in the yellow phase. And in the 4.0, they did say if you're checking temperatures and if you're doing other things like we've already discussed, perhaps you could start safely running your programs at that yellow phase. Again, it really is going to be determined on the mass gathering restrictions and how do we cut up the fan base? How do we address the mass gathering component, which again may kick some of these sports into the green phase. We realize spring revenues are a big deal for a lot of cities. So baseball and spring soccer, that's pretty big. We're probably going to take a good 30-40% hit in some of our youth recreation revenues for this year. Luckily, it's not going to impact our overall city budget, but it is pretty significant. And so we are cognizant of all of these things. We do feel like, though, that renting your fields or renting your pavilions might have some risk. And so we've identified some things you may want to consider relative to that as we were looking at this. And again, we thank you for your time. I'll keep mine to any questions that we may have. And then John and the league can disseminate the information that we've pulled together.
Thank you, Mark. Nancy Day, Recreation Director at West Valley City. Going to talk a little bit about parks and playgrounds and those kind of things. So Nancy.
Hi, well, welcome everybody. It's good to be a part of this, and I appreciate the opportunity. One of the things that I wanted to mention, and somebody else brought up URPA, the Utah Recreation and Parks Association. All of these things that we're kind of discussing in these groups, your Parks and Recreation professionals have been meeting, the directors have been meeting on a weekly basis. We've even had dialogue before Utah got into red. So I would definitely reach out to your Parks and Rec departments, because I think you're going to get a lot of really good information on even the team sports modifications that can be done. I think that will be really beneficial. So going into parks, one of the biggest things, and several people have mentioned this, is that there are different needs per city, per agency. There's site specifics that are going to be different no matter where we're at. The use of those amenities is going to be different, and certainly demands that are placed on elected officials or city administration are going to be different. And finally, the resources. And I think Cameron brought up in the chat that to really reach out to the CARE Act, keep logs of what you're spending personnel-wise and equipment, as far as chemicals, those types of things that you're using specifically for this COVID-19 crisis that we're in, so that hopefully there'll be some reimbursement with that. Another thing that we talked about in our group was the amount, and I've got just a quick sheet that I'll share here in just a second, but the amount of work that we can feasibly do based off of personnel, financial resources, supplies even. We feel that we may at times be giving a false sense of security to our communities in that, for example, if you're able to disinfect your playgrounds once a week, as soon as somebody touches it, it's no longer disinfected, right? So we feel like one of the biggest things that we can do is the communications plan that's set and put into place in all of these areas to really educate the public on what they should be doing to protect themselves. We're doing what we can, but it's clearly not going to be disinfected, especially when we talk about these outside areas for everybody that comes up to use those. So we really need to make sure that we are communicating well with that and putting up signage. And I'm going to go ahead and share my screen. And actually, I don't know if that is, well, I don't think I can get that to work. I apologize. Well, I can send this if anybody
Okay,
wants it.
yeah, and when we'll distribute it later, yeah, even if we can't get it to share. Nick, can you get the screen to share
Okay.
or not?
Yeah, I clicked it and I'm not sure. I've not done that before. I just clicked the share screen box. So,
Yep, no worries. Make sure you send it to us and
okay,
we'll share it after
we'll
the
do
fact.
that. And so I'm going to go through this fairly quickly. So please, feel free to stop me or put something in chat if you'd like me to take a minute. I'm going to go over some general things first that we've discussed. Some of that is what I just talked about in communication, and the signage and communication that needs to go out is not just signs in your general and activity or area specific places, but through your social media sites, your websites, email blasts, a lot of your parks and recreation, whether it's through programs or if you have a facility that have memberships, they will have email lists that they can send information out, text messaging. A lot with the sports have setups already for teams and leagues and things. So really getting information out there. If you have an electronic message board, you could put small messages there, and certainly any type of cross marketing through even other departments. We'll cross market to our golf course information through other divisions and vice versa. And I think that goes a long way because we all know word of mouth is the best way to get information.
Nancy, I think we lost you there for a moment.
Out there. Oh, I'm sorry,
Okay.
Can you hear me now? Can you hear me okay?
Yeah, you're back. You're back. Thank you, Nancy.
I'm back.
Yep,
Okay, sorry.
welcome back.
Okay, unstable internet is what it says on my screen. So I will talk really fast. So I don't know how much you heard on the communication side, but another thing we talked about was really posting signs to inform the public when we're cleaning and disinfecting certain areas. So if we're cleaning and disinfecting a playground, for example, which right now in orange, they're closed, but we will get to that point in yellow where we can't open the playgrounds. Then if we're saying that Tuesday from 9 to 11, we're disinfecting this particular park's playground, then people know that that's going to be when it's the cleanest, I guess you could say, right? If they come on a Saturday, they're really making that decision themselves to do that. And so it's not ideal, but I think it's the best way for people to be able to make their own decisions on that. Jumping into, well, another part is the staff, and that was addressed quite well by Doug, I thought, with equipment, personal protective equipment, all of that. The staff need to be trained on what type of equipment they'll be using, how to protect themselves, what type of products, chemicals, solutions, how to prepare those mixtures. These are all a little bit different than what they've been using in the past, and they need to understand that. Another side of that is they need to understand the signs that have been put up and what those rules mean and how we want them to respond to the public. A lot of times our park staff will have interactions with the public that will be there, and those individuals are going to ask our employees about those rules. It's important that we train our staff on understanding what they are and why we have them so that they can communicate in a manner that we would like them to the public. In parks, most of what we're finding right now, pavilions are not, there's no pavilion reservations, which I think is the right thing to do because they're typically larger groups. There are some small pavilions that are still open in some cities that are still having their pavilions open, even their large ones, but they're not taking reservations, and they're discouraging, telling the larger groups, obviously anything over 20, that they can't participate with that and have those groups there. We are seeing an influx, as you have seen in the media, in all parks at all levels, with people just flocking to them. And that's not been any different in West Valley City or as I talk to colleagues in any of your communities. So any kind of presence helps with that. Restrooms, again, make sure you post how often you're cleaning and disinfecting, whether it's once a day, twice a day. We're seeing some differences at the agencies, again, based on their resources and what they have available to be able to clean those. As far as trails or any walking paths that you might have, I would suggest signage at any normal points of gathering. So at trailheads, where there's drinking fountains, where there's connection points with other trail systems, any type of signage you can have to minimize that social distancing at those points, I think is critical. Playgrounds, again, we're not going to be opening playgrounds in orange. That's a yellow opening. So we need to, again, post that those are closed. They are the only areas, unless you have specifics in your community that you want to do, they're the only areas that are required to be closed. I know that somebody asked about skate parks in the chat there. Skate parks can be open. Everything, though, that we have to remember needs that social distancing. That's the biggest thing. So you can have those areas open. You can have the pavilions open, but you have to be able to try to convince our public to maintain that social distancing or close areas off if that can't be happening. We are looking at, there's a number of agencies, and we're one that are looking at, instead of doing kind of a bleach mixture using chlorine, a lot of us have pools. We have a lot of chlorine that's highly accessible. That also works extremely well. There's formulas out there. Your aquatic staff are very familiar with that and can work with your park staff. We want to be sure whatever type of chemical is used for disinfecting, that the equipment is such that we can ensure that there's not overspray to vegetation. We want to know what are the effects of that, not only on the playground equipment, but the surfacing below, if you have a poured in place surface, or even mulch for that matter, what is the effect of that? So that's something important to remember when you're determining what type of chemical to use, and something that you can have accessible for the long term. You know, again, is it easy to get? Is it easy to store? That's something else you have to think about. The equipment you'll be using and how you're going to be storing it, so that there's not any type of cross-contamination, and that it's set up in such a way that's easy for your staff to use. And then, you, of course, somebody else I think mentioned this, might have been Doug, that we need to make sure that there is drying time. So if you're calculating that I need staff for this many hours at this playground and then move along, they need to make sure that it does dry before somebody gets on the equipment. And if there's patrons or community residents that are around, it's a really good time for the staff to interact with them while they're waiting. It doesn't take very long. Outside is actually really pretty good because of the UV. You know, you've got your oxygen, you've got the ultraviolet rays. Those things are really helpful when it comes to this, but there's still these protocols here. And lastly, that we were asked to talk about were the sports courts. So these are pickleball, tennis, basketball, volleyball, all of those types of courts out there. Again, this is very site and agency specific, and your staff in Parks and Rec will be the best to talk to on that. But one of the things we've looked at is singles only for tennis and pickleball. So you can't play doubles games. Again, we're posting signs on that. If people in those types of facilities, you know, they're fenced. We can lock those up if we find that the public is not following social distancing rules. We'll lock those up, and we're not opposed to doing that for the safety of our community. Our skate park is not fenced. A lot of yours might be. Ours is not, so that's kind of a different beast there. Basketball, I've not ever seen a basketball game where social distancing is even possible. So we are really trying to encourage people not to do that. And personally in our city, we're going to be doing some programming out there where it's individual programming, like a horse tournament, or things that we can control the number of people that come at certain times and the number of people that participate at those times. So trying to find alternatives might be a way to help with that. But honestly, as all of this that I've just talked about, the biggest thing is the high level of personal responsibility on our citizens. And I think the best way to do that is the communication. And I applaud our health departments at the state and the county levels, because I think they've done a really good job making signage that we can all use and things. So that's all I have. So.
Thank you. You know, as we talked about this, it was interesting because, as you mentioned, under Orange, we're probably just we're trying to just have singles at pickleball and tennis, and everybody can see why that is the case. But if it's a family group or a group that shares the same household, it actually becomes a little ridiculous to only have singles. And so how you deal with that is a difficult, it's not as cut and dry as we kind of like to present that it is. Nancy, what are you doing with your playgrounds? Are you just putting like police tape around it? What are you doing to try to keep people off your playgrounds?
We've seen different communities do different things. What we've done is we've just put up a closed sign with the current rules and the status of what orange means. We've utilized some of the signs from Salt Lake County Health Department to help us with that. We have not yet taped them off or anything, and knock on wood, we haven't had any problems with the playgrounds. They've actually been really pretty good. Now that we're opening up more in the parks, we may see a problem with that. And if we do, then we will use some caution tape or some things along those lines. You've seen that, Mark? Is that?
We actually had some vigilantes remove the construction fence that was around some playground equipment. And we were some of the people that were complaining and asking for state guidance early on because, again, you know, we're sanitizing the playground with bleach and trying to keep it clean, but we just had hundreds of people that would gather at these things. And so it's a challenge and it's only going to get worse.
I agree. And you know, when it comes to enforcement of any of this, it's really going to come down to your city administrations on if they want or even can have the police departments make patrols through there and try to let people know they can't do it. When the skate park was closed until today, it wasn't closed. I mean, there were kids out there constantly. So I could appreciate what you're talking about there. We're not gonna, I think realistically, we're not gonna be able to prevent everybody from doing things that they shouldn't be doing at this time. We can only do what we can do with the resources that we have. And we're not interested in putting up chain link fencing or anything like that. We did the same thing, Mark. We had a pump track a while back when we were finishing. We put some temporary fencing around it. And the kids were just jumping right over the top of it to use the pump track. So it's a tough one. It really is. And you know, that's different cities are doing different things. Some are being a little more aggressive than others. We'll have to kind of see what happens.
Okay, and splash pads fit in the same thing as skate parks, right? They're not specifically mentioned in 4.0, but it's your call. I think I wouldn't open splash pads, but you have to make sure that the distancing requirements are there.
John, I would say splash pads are more akin to pools, aren't they?
Yeah, I have to agree.
Fair.
They're more akin to pools because they're wet surfaces, hard, you know, moist surfaces harder to keep clean. And how do you keep kids from just being on top of each other in a splash pad? So,
and a lot of communities are closing their splash pads or their water features. We have a water feature that we're not going to be opening because even though, you know, anything that you might potentially have chlorine going through, it's probably one of your cleanest places, most sterile, right? But it's a gathering point. And I think that's what we have to look at in our parks. If we have an amenity that is just by the very nature of it, a gathering point for larger groups, that's where we have to make a determination. Should we keep it open or should we not? Same thing with events. Is it going to bring people in the masses that we don't want to see? And that's where we have to make those judgment calls.
Okay, and what about things like drinking fountains? You're just keeping those turned off in your parks? And I think that's what we've talked about doing as far as our group thing. So, all right.
Yes, and then having a protocol once we get into yellow.
Okay, I think we've answered every question that I've seen in the chat or the question area. I would like to thank all of our panelists today. Mark raised his hand, wants to add something.
I got an email as we were talking. What do we do about comp leagues? What do we do about comp leagues that are chomping at the bit, wanting to get their teams going? I believe this is something that is a critical question that we need to get the answer from the state from, because I believe there's a perception out there that comp leagues, whether it be soccer, basketball, volleyball, whatever, that today is the day that they get to open up and start practicing. And so I think some of the challenges that we've talked about are there. The policy, the 4.0 policy points out that you should not be doing team sports right now. And I think that that's going to be a challenge, especially since they're largely outside our control. I think our parks are going to be used for these teams. And I think that, you know, this is one of those questions that we just push on up the food chain and say, please help us give some guidance and some clarity for those that are going to be looking to move in that direction. Thanks.
Yeah, good stuff. And I just kind
John,
of.
John, can I add one thing there?
Yes.
Yesterday, John and I were on a call with the Association of Local Health Districts about this very question. And so the local health districts, counties, and cities are asking that very question of the state, trying to get some more guidance and some more communication around those comp leagues.
Yes, and I just like to add from Parks and Rec, because we're getting inundated, obviously, from these leagues to use those parks. And many of us, if not all in the state, we are saying no. Now, I know there's different counties that have lower numbers or different things are working locally, but I know up in our area, we're just saying no for practices, for games. They can't use them. And if they do, then they're putting their potential opportunities to use those fields at risk because it isn't safe, and they shouldn't be doing those right now.
Okay, just a couple of follow-ups for those that are still on. I know we've been using the word kind of directive and order as far as the governor's council, but the latest thing is an order, and so which is a higher standard. And the last thing is we feel like everything we've talked about, that we're not going to be in orange for a long time. You know, a lot of people are looking at that is a matter of months, but we think it's going to be a matter of weeks. And as cities, we need to start preparing for that. You know, we've heard it could be as soon as the middle of May, and so that's obviously still a moving target. But don't just, you know, set where you're going. We've got to be planning, even though we hit orange today, and we've got to be planning for yellow as soon as we possibly can. With that, Cameron, do you have anything else you'd like to add? Okay, great. Thank you for your time. Thank you for our panelists. If you'll also just send me your slides. I think most of them I already have as far as the last 4 people, but I will get those posted, and you can see a copy of this entire presentation on the league website soon. So thank you very much, and have a great day. And Nancy, I hope you hit your tea time. So, okay, bye-bye.